Hello, I'm Dr. Samira, a board-certified urologist. Many of my patients have requested me to make a YouTube channel so that they can get benefit from basic urological information at home. So yeah, here I am with the very first video. Today, I want to introduce you to a medication that has shown remarkable promise in the treatment of erectile dysfunction, a drug called Avanafil. While it's not yet widely discussed in certain regions, especially in Brazil, it deserves attention due to its scientific backing and clinical efficacy. I invite you to stay with me through the end of this talk, where I'll explain not only how it works, but also how it compares with other well-known medications in its class. Avanafil is a phosphodiesterase type 5, PDE5 inhibitor, just like Sildenafil, commonly known as Viagra, and Tadalafil, Cialis. These medications all work on a similar biochemical pathway. They increase the intracellular concentration of cyclic guanosine monophosphate, cGMP, in smooth muscle cells. This increase in cGMP facilitates vasodilation of the penile arteries and smooth muscle relaxation in the corpora cavernosa, allowing for increased blood flow into the penis and thereby enabling an erection in response to sexual stimulation. What sets Avanafil apart is its ultra-rapid onset of action. It is absorbed much faster in the gastrointestinal tract compared to Sildenafil or Tadalafil, which means its effects can begin within 15 to 30 minutes after oral administration. This shorter onset window provides patients with greater spontaneity and less need for planning sexual activity in advance, which is a meaningful benefit from both a psychological and lifestyle perspective. Approved by the US Food and Drug Administration FDA in 2012 and later by the European Medicines Agency, EMA, in 2013, Avanafil has been on the market for over a decade. However, it's important to note that due to regulatory constraints, it has not yet been approved for commercial use in some countries. Nonetheless, for patients living abroad or traveling to countries where it is available, it is marketed under the brand name Stendra in the United States and Spedra in Europe. Avanafil is typically prescribed in doses of 50 milligrams, 100 milligrams, or 200 milligrams, depending on the patient's response and tolerability. The most commonly recommended starting dose is 100 milligrams, which can be titrated upwards to 200 milligrams or downwards to 50 milligrams, based on individual efficacy and side effects. It's important to always use such medications under the supervision and guidance of a physician. While Avanafil offers the clear benefit of rapid onset, one trade-off is that it has a relatively shorter duration of action, with a half-life of approximately 6 hours in the bloodstream. This is notably shorter than Tadalafil, which can remain active for up to 36 hours, earning it the nickname, the weekend pill. Sildenafil, in comparison, usually offers efficacy lasting between 8 to 10 hours. Like all PDE5 inhibitors, Avanafil is a potent vasodilator and therefore shares a similar side effect profile. Common side effects may include headaches, nasal congestion, facial flushing, back pain, and muscle aches, myalgia. Interestingly, recent studies suggest that Avanafil may cause less myalgia compared to Tadalafil, making it a potentially more tolerable option for patients who have experienced discomfort with other medications in this class. Contraindications for Avanafil use mirror those of other PDE5 inhibitors. It should not be used in patients with significant cardiovascular disease, particularly those who are taking nitrate-based medications such as nitroglycerin, isosorbide dinitrate, Iserdil, or mononitrate, monocordal, due to the risk of a severe drop in blood pressure. Despite its unavailability in some regions, I find it important to discuss medications like Avanafil, especially because I have many patients and followers from abroad, or those who travel and may come across this option. If you are considering trying Avanafil, it is crucial to consult your physician, discuss whether it's appropriate for your health condition, and ensure that you obtain it with a valid medical prescription. If you found this information valuable, and if you believe it may benefit someone you know, I encourage you to share this content. Don't forget to subscribe to our channel, activate notifications, and stay updated with our weekly health insights. Take care, and I'll see you in the next video.